Audio Jungle.
Hello everyone, this is Dr. Achmed Kamara, Doctor to You. I hope you're all doing well. I want to share with you an experience with a patient that I spoke to on the phone. So this was a telephone consultation. It's a lady in her 40s with an only son below the age of 10. And in fact, the purpose of the call was to discuss an X-ray result she had done of her hip. Now, this lady speaks very good English, but English is not her first language. She's originally from one of the European countries. We went through the hip X-ray results. It was actually fine. There was some minor wear and tear there, but nothing really of concern. So we got through the consultation on that note fairly quickly. We built a really good rapport in the few minutes that I was on the phone talking to her about the hip X-ray. And just before I closed the consultation, she said, "Doctor, this might be a really good opportunity to talk to you about insomnia, lack of sleep that both her and her son have been experiencing for a number of years." So her son is 7 years old. So she described herself as a single mom. They live in a one-bedroom apartment, so it's actually a one-bedroom within a shared living space, and she shares a room with her son. Her son sleeps on the bed and she sleeps on the floor. And she's not currently working, not able to work. She goes to the job center and is actively looking for work. But she said every time they go to bed, and they usually go to bed about 10, they, almost by clockwork, they wake up at 1 o'clock or 1:30. So they both get no more than 3.5 hours sleep. Sometimes the son wakes up before her, sometimes she wakes up and they can't go to sleep at all until the following morning, and this has a big impact on her and her son. And she's tried absolutely everything. When I say everything, that is non-prescribed therapy for insomnia. If you look up sleep hygiene methods, you will see what all of these things are. So it includes, for example, not drinking anything with caffeine, or limiting caffeine intake as much as possible and keeping it to below, before 1 p.m. or 2 p.m. at the very latest. Not exercising too close to bedtime, having relaxing music before bed, having a nice warm shower bath before bed. Hot chocolate can be helpful as well. I mentioned nice relaxing music, and classical music is usually the go-to. But there are lots of other things as well, making sure the room temperature is fine, you've got good sort of air coming into the room during the day. So make sure it's nice and refreshed. Make sure that your bed is nice and comfortable. So lots of other things. Switching off screen devices, at least an hour before bed, and not being tempted to look at them when you wake up. I mean, the list goes on and on, but she's tried absolutely all of this. And what petrified her was they wanted to, one of her previous doctors had recommended the use of medication, not directly, but they wondered whether her son might have something called ADHD, and as a result was investigated for that. No one actually mentioned the use of medication, but she was just anxious that the only way to get her and her son to sleep would be to revert to actually result in the use of sleeping tablets or medications. And she absolutely didn't want to do this at all. Okay, I pressed on her. I said, well, look, what else can we do? What else can? And she tried everything. So in terms of her, because the consultation was about her, I mentioned, well, look, we may need to try for a short period of time sleeping tablets, just to help you get into some sort of regular good sleeping patterns, and then we can stop it again. But I think that pressed the button, and she became quite tearful. She was really sad, and then she, I said, is there anything else going on? And that just opened up the floodgates, and she shared with me that she's, and this is her words. She said, look, I feel useless. I feel like I'm not a good mom. I feel sad when other parents tell me that their children sleep very well. I do everything for my child. I am God-fearing. I go to church. She goes to church. And I'm not sure why this is happening to me. I can't find work. I get really stressed going to the job center to report, to look for a job. I wonder, what if I lose my benefits? So it opened up a can of worms, basically. And look, what was meant to be, what I thought was probably going to be a 5 minutes consultation and scheduled for a 10 minutes consultation ended up being a half an hour consultation. I couldn't close it at that stage. I think it would have been very inhumane of me, unsympathetic, and I just didn't have it within me. You know, I was very empathetic with her circumstances. And look, you know, it touched my core. But at one point, I thought, you know, let's forget the medical hat. Let's forget I'm a GP. Let's put on my personal development hat. And I told her, lady, look, for confidentiality reasons, I won't share her name. Lady, you just, you know, be quiet for a second. I want to tell you a few things. I said, look, you're not just a single mom. You are not useless. You are capable of finding a good job. The job will come. You have to think highly of yourself. You have to think more positive of yourself. You know, I went on my personal development rant and talked and tried to motivate her and you know, lift her spirit up, and you know, I think it worked. You know, she perked up and she was really appreciative. She thanked me a lot. And look, but that's not the point. At the end of the consultation, I told her, I said, look, this is what you're going to go with. I said, look, write down 5 to 10 positive things about yourself. So positive affirmations. You know, I am great, I'm a good mom, I'm whatever it is, okay? There are lots of things that we can all think about. And repeat that to yourself. First thing in the morning and last thing before bed. Still do everything that you do, including praying, etc. But do that first thing and last thing before bed. I also, you know, put her in touch with psychological therapy service that's available. She doesn't want medication at this stage, and that wasn't a conversation that was worth pursuing for now. But you know, she left feeling quite hopeful. She left feeling like there was light at the end of the tunnel. And it just struck me, you know, the role of personal development in medical sciences. You know, it's not always about what we prescribe. It's not always about the test and, you know, the very fancy, complex investigations that we do in hospitals. Sometimes just listening and trying to encourage someone and trying to reaffirm and reassure to them that they are deserving of better things, and they need to love themselves and tell themselves that they are deserving of better things, might be the way to initially get them to recover, to recuperate, to heal whatever hurt there may be going on. We can't do that in 10, 20 or even half an hour as I did in this consultation today. But hopefully she'll be more open to speak to the psychologist that she gets to engage with. You know, hopefully with time she may feel more positive about herself, which will, you know, impact her children, her son, and her son's future potential. Well, look, I just wanted to share that with you, just to share. I thought it was an interesting experience. It's, you know, consultations are not always what we think they're going to be about. They're often, or they're sometimes, you know, some other hidden agenda that perhaps the patient themselves might not be aware about, and only becomes revealing once we ask probing questions, as it was in this case. Anyway, that's it from me today. I wish you all the best and have a really, really good day. Take care.